C24 brings you a lifestyle show from women you know. Now, Central Valley Today.
We all know a fountain of youth does not exist, but aside from eating well and taking care of ourselves, there is something we can do to keep that young look alive. It's called Botox. And a lot of people can inject you with Botox, but why is it better to have it done by an MD? Well, at the MedSpot IQ, Dr. Campbell Waldrop has been doing it for more than a decade, and our Alex Delgado got some expert advice.
Well, we all want to feel good, we all want to look good, but the aging process is inevitable. So how do you get the most youthful you? Well, let's ask Dr. Waldrop from the MedSpa here at IQ. Doctor, thank you so much for having us here.
Our pleasure.
Beautiful office.
Thank you. We're very proud of it. We're excited to have you here.
Let's talk about the unique experience that patients get here at the MedSpa that they receive here.
Yes, this is my 14th year at IQ. It's my 15th year doing Botox treatments. I really enjoy doing the treatments and getting to know my patients. In fact, some of the patients that I've cared for the longest are my Botox patients, and I believe they really value the fact that I'm the one who's actually doing the treatment for them.
So why do you think people should even consider Botox?
Botox is an exceptional product, and it really helps fight wrinkles. So it's safe, it's effective. For people who want to look better and feel better, I think it's a really nice option.
Is there really a difference in results depending on where you go to get the treatment?
Yes, I really believe there is a difference. The amounts, the angles, the anatomy, the patient's goals, putting all of that information together and synthesizing it for a particular treatment plan for each patient really does make a difference, and I take great pride in how I do my injections.
And speaking of injections, a lot of people sometimes are a little leery of injections. They may be a little scared of them because they think they might hurt. What can you tell us about that, and how can you reassure people that it's really not that bad?
Yeah, you're right. That's a common thing that people ask us. We have a great topical numbing cream, and we use one of the smallest needles that's available. Most patients, when they've gone through it, they're surprised at how comfortable it is.
I think that it's just getting past that little hurdle at first that you might be a little timid, a little scared, but once you do it, you see the results and you're thinking, wow.
Yeah, no, I think most of the time for patients, that first time, there's so much, I think, misinformation out there regarding Botox. And once they've kind of been through the process and they can judge for themselves, I always tell patients at the end of the day when they're looking in the mirror after their Botox, they're the best judge of whether it's working for them or not. But you're right, once we can get people to try it once, they tend to really like it. It's safe, it's effective, it makes them feel better. It just has so many good qualities.
What about downtime?
None.
That's the best part about it, right?
It's easy. I mean, it's the process of coming into the office. We put on the numbing cream. It takes a few minutes to work. We do the injections, which generally take us just a few minutes, and then they're off and they can go do whatever their normal activities are. They can go to the gym. They can go shopping. It's one of the things that makes it so appealing to so many people.
And where are the most common places where you can get Botox?
The most common places are between the eyes, around the eyes, some on the forehead. Those are the most common. There are some other places that, again, basing it off the patient's particular treatment goals and their anatomy, we may use it in a few other places.
What about men? Because, hey, men get wrinkles right here on their forehead, right?
Yes.
Right? And wrinkles around their eyes.
Yes. Men are a little bit harder sell on Botox, but there are more and more men who are doing it. I do approach men differently than you would approach women, and again, that's all part of that discussion that I have with the patients, and it's also part of the reason that I really like doing the injections. I enjoy getting to know them and kind of really making sure that what I think we can achieve is what they're actually looking for.
You talked about in the beginning of our interview about how important it is for you to be doing the injections as a doctor. A lot of people may not realize the importance of that.
Yeah, and again, I take great pride in it. I've always wanted to do it. I think it takes a certain understanding that's part of my particular training, and so I've always valued it, and again, I hope the patients who come to us value it also.
So at what age do you think that at what age would you recommend women start getting Botox?
Well, really, again, it depends on the patients. On a number of factors. I think most people would probably in their 30s to 40s would be a reasonable time. I tell people Botox works better in prevention than cure.
Okay.
But those are, again, there are situations where it can vary for each person, but probably 30s to 40s.
Okay. And before we go, really quickly, how long does it last? Because I'm assuming you get a lot of reoccurring patients.
Yes. Yeah, that's a great question.
Yeah.
Should have. It lasts about 3 to 4 months.
Okay.
So it is an ongoing process, and that is part of the reason I get to know my patients well, because we're seeing them several times a year. So it gives you great flexibility.
Perfect. Okay, so is it just as easy as calling and making an appointment, or is there a consultation?
It's just as easy as calling and making an appointment. There is a consultation. Again, I like to evaluate each patient. They can also go to the website, Waldrop MD, to schedule a consultation also.
Perfect. Well, it sounds easy, and it sounds like you really love what you do, which makes us feel a lot better.
Yeah, I do.
Okay, good. So nice to talk to you, Dr. Waldrop, and thank you for inviting us here to your beautiful office.
Thank you for being here.
Of course.
And still to come, it's a tradition that might make you think of Grandma. But at Casa de Tamales, these tamales are not your grandma's at all. See how to get the delicious treat for yourself for the holidays right after this.